Okay, so I'm Gladwin Fernandes, physiotherapist for the last 15 years, 16 years. Um, I've mastered in musculoskeletal and sports, and it was very interesting when Sheldon asked me to talk about if I have anything to talk about to do with exercise and diabetes, and I felt it was really good of him because that's something that I've been working on for myself since December last year, 2024, when I was tested. Um, Not tested, but yeah, my records showed that I had diabetes. My HbA1c was about 7 point something, which was diabetic, and it got me a little worried because I had a cyst on my back and that was not healing. And so I said, let me start working out now and doing what is required for that. And I started researching, I started exercising for that. Okay, and the reason why I am in a better position to help you all out here is because I tested it on myself. And there were times when I ate sugars, had desserts, went for weddings, did everything, and I came back home and tested my sugars, and they were normal within an hour. It was normal, and that is because I realized I danced that full wedding, and there was a lot of energy expenditure there. So anyway, let me give you a little a little brief of diabetes and exercise and the effect of exercise on diabetes. Let me talk about insulin resistance and insulin sensitivity. I will show you all the effects of diabetes or the effects of exercise on diabetes, sorry, and I'll show you all at the end some practical ways of how you can increase your muscle bulk, increase your muscle tone. So when he spoke about sarcopenia, I would talk about atrophy, where your full muscle bulk reduces as you advance in age. Or if you're more of a sedentary, not only age, anybody for that matter, will go undergo atrophy if they don't use their muscles. So I will show you all those exercises. So what is insulin? Insulin is a hormone secreted by the pancreas. It helps to move sugars from the blood into your cells. It is used for energy or storage. Now, what is sensitivity? The cells respond, so your body cells, insulin sensitivity is when your body cells respond to insulin. Vice versa, resistance is when your body cells do not respond to insulin, and hence your blood sugars increase, which is then type 2 diabetes. So here's a small illustration, very clearly seen the good insulin sensitivity above and the low insulin sensitivity. So if you look to your left, you will see sugars from your gut digestion, they enter into your bloodstream. Then below that you see the pancreas secreting insulin, which again is into the bloodstream. Now onto your right side of the blood vessel, what you see is the insulin combines with the sugars and then goes into either your fat cells or your muscle or your liver. Okay, thus decreasing the amount of blood, decreasing the amount of sugars in your blood. Now coming down, when you don't see there's already a lot of sugars in your blood cells, the blood cells then not in the blood cells, when the amount of sugars increase in your normal cell, that's when the body does not want it. Your cells do not want extra sugars in them, so they start throwing them into the blood. They don't accept it anymore. That is resistance. Okay, so there are two things. Sensitive is when the blood cells need glucose or need the sugars and they use it, and sensitivity and the resistance is when there is too much of sugars in your blood cells, in your muscle cells or your body cells, which now they do not need that much of sugar, so they push it back into your blood, thus increasing the sugars in your blood, causing diabetes type 2. Now, what are the risk factors? You have obesity, which is especially the one which when you see people, or you may have this belly fat. Even I had a bit, so working on that. Sedentary lifestyle, having a diet which is high in carbohydrates. High carbohydrates, which means bread, pasta, your pastries, okay, all foods that increase, that just give you sugars, that just break down to carbs, and sometimes age and genetics. Okay, so what are the effects of exercise? When you exercise, you are increasing your muscle bulk. For an example, if I'm using only my biceps to, um, I'm just working out my biceps. So what is happening is there is energy required to burn that, to have this movement, to do this movement. There's a need for sugars or energy in the form of glucose. So the body starts mobilizing the sugars now, which is already stored in your muscles, in your blood, in your livers, wherever they are stored. They start using them. Okay, so hence, when they are moved from the blood, it lowers your blood sugars. Again, why then? So because you have done the exercise, your um, your body cells now require energy. So insulin sensitivity increases. Okay, so more glucose now is available for use. Then it burns down fat, which is true. You've seen people exercising to lower their body fat and to lose weight. So yes, exercises lowers your body fat. It improves circulation, it improves energy, and improves mood. So for me, I love exercises for the fact that it makes me happy. I love sports because it makes me happy, competitive. Exercises are used a lot for even those who are in, um, who are getting psychotherapy or who are having depression. Exercises now are used over there, where it also stimulates dopamine, increases their mood, makes them feel better. Okay, now what does exercises do on muscle? They increase the muscle bulk, which is the opposite of atrophy or sarcopenia. It causes hypertrophy, which is increase in the number of cells. So when you have increase in the number of cells in your muscle, obviously it needs more energy. Hence, it's using more uh, glucose from your blood. It will then, once the glucose from the blood is mobilized, it will use the glucose from your muscles, then from your liver, then below the skin, your fat. Okay, now your resting basal metabolic rate also increases. What does that mean? Because you have an increased muscle bulk, so because you have an increased muscle bulk now, even if you are resting, to keep those muscles alive, your body is burning energy. And that is why some people who have this high metabolic rate, you see them, they eat a lot, but they never grow fat. You will never see them putting on too much weight. One way of increasing your basal metabolic rate is doing exercises regularly, where you're training your mind, you're training your brain that yes, I am going to increase, the body needs to increase its basal metabolic rate, so that there's a lot of energy expenditure even if you're resting. Okay, so thus increasing the muscle bulk helps increasing the basal metabolic rate. A few guidelines. It's best to target about 150 minutes per week. Moderate aerobic activity I'll explain later. Then strength training at least 2 to 3 times a week. Okay, so you don't really have to do aerobic every time. You can space them out and then add strength training in between. Say if you're doing an aerobic thing, you can do an aerobic on Monday, Wednesday, Thursday, Saturday. Okay, the rest of the days you do strength training. Okay, a warm up and cool down is always important. Okay, safety tips which each one of you all should know. always monitor your sugars before and after your activity. Mainly, this is mainly for those who are diabetics, who are on insulin, and who are taking medications, because when you work out or when you do your exercise, your blood sugars may suddenly drop, causing hypoglycemia, and you may suddenly faint. There are a lot, you can prevent a mishap happening there. So it's best to monitor your sugars before and after your activity. Okay, you can start slow. You can yeah you can start to exercise slow. You don't really have to do 20 minutes every each time when you're starting. You can start with 10 minutes of exercise and then progress gradually. Okay, have a fixed time for your exercise. Try to So when you have your sugars in place, when you just start monitoring all your sugars during the day, at what times they are high and what times they are low. Okay, and based on that you can start exercising. You can maybe speak to your general practitioner also, or your medicine doctor, to help you with this. Okay, how do you start exercising? You will do a basic warm-up first. A warm-up is very important because it will gradually start increasing your heart rate. It will keep your muscles warmed up. You will prevent muscle tears or a catch or a cramp happening. Okay, so it's very important to do a warm-up about 3 to 5 minutes, which would mean you can do a spot marching. You just march, stand and just march. Do some arms circle. Just walk sideways. Breathing exercises are very good to increase the oxygen capacities. Okay, and general PT exercises, just twist what you would do in school. You'll have to refresh your memory to start all of them. Okay, now coming to cardio. What's a cardio exercise or an aerobic exercise? These are the ones which work more on your lungs to help you. What it helps you in, you won't get tired very easily then. If you practice this for a month, you will see yourself getting less tired. You will feel yourself being able to walk more. Okay, so that is what cardio does, aerobic capacities. What it involves: brisk walking, or you can walk at a spot. If you cannot go out, if it's raining, no problem. You can just stand in your balcony or stand holding a chair and just spot walk. Those who can cycle can cycle. If you have a stationary bicycle, you can use a stationary bicycle. If you have a gym, you can go to the gym close by. Step ups is if you have a stepper in your house, repeatedly doing it for a continuous period of time. Up down, up down, up down. Okay, seated marching is for those who are finding it difficult to stand and walk. So you can just sit and do your marching, where you're raising your legs up and down in sitting. Light dancing, definitely nice. You can play some light music for 15 minutes or half an hour, whatever music you like, and just start grooving, just start moving. Yes, you have to get a little tired slowly, but continuously keep doing it. Chair bicycle is another equipment. It's a small triangular equipment which you can keep near your feet while you're sitting, and you keep cycling, keep pedaling. It has a counter which tells you the amount of steps, the amount of kilometers you have moved. Strength and muscle building. Can you get me that, please? One of them. So for strength and muscle building, we use TheraBands. These are TheraBands. These are the loop. They have handles. Then you have this elastic bands also, which you can do exercises with. Okay. You have these kind of resistance loop bands. These are a little tougher sometimes. You can use them in various ways. You have ankle weights, where you can open it up. You can strap it to your arm. If you're having a weak grip, you can strap it to your arm, do it, or you can put it around your ankle, like that. Just put it there and then move your hand up and down. You can use them as resistance. Some may have dumbbells. If you have nothing at home, you will at least have a water bottle, which you can use to do your upper body. Okay. Then we have body weight exercises like calisthenics, which is push-ups, squats. I will explain that later. Okay. Types of exercises: aerobic, which I have explained, which is walking, cycling, swimming. What it does, it improves your heart health, improves insulin sensitivity, resistance training like weightlifting or resistance bands, which I just showed you on. It builds muscle, improves glucose uptake, flexibility and balance exercises such as stretches. Try to stretch yourself to the side, rotate around. Stretches, yoga. You all just had a session, beautiful session. Yes, very good. There's Tai Chi, which is another Japanese form of an exercise which helps in balance and flexibility. Okay, what it does, it improves your flexibility with your joints and your muscle strength as well. Okay, are you all ready for the practical part of it? Thumbs up. Yeah. Okay. So if you all have a difficulty in doing all of these, okay, I will show you all. Sheldon is going to be my model for today. I will explain while he also does them. And I'm sorry I couldn't get a takeaway printout or something from here, but I will promise you within a week you will get that. I will work on that and give you all a full exercise plan which you all can do. Now, before you start with your exercises and everything, I also want you to, if you all have any condition like maybe say an arthritis or a ligament tear or a frozen shoulder, maybe cervical spondylitis, back slip disc, I would advise you all to please take an opinion with a physiotherapist. If you all are too far, you can go to the nearest physio, get their opinion first, get yourself assessed, and then do these exercises. Now, these are very basic exercises which I'm showing, but some may be good for you all, some may not be good. So that's why I recommend you all meeting a physiotherapist or a physical trainer may not be able to help you all much, but at least a physiotherapist in a local, wherever closest, or maybe you can get in touch with me. We can maybe have an online session as well where I understand what is your condition, and then I will guide you all with what not to do, what to do and what not to do. Basically, otherwise these are very simple, can be done by all. Yeah, let's start them. Yeah. Okay, so here we have Sheldon. So we start with the exercises in bed.
Lying on the bed.
Yes. Okay. Are you all able to see him?
Yeah.
Okay. Yes. So now you see Sheldon lying down. The first exercise will be your arm raises. Now Sheldon, please raise your arms up straight above your head and get them back. This will help your shoulder mobility, frozen shoulders, it helps. Okay, and down. Then we can move sideways above your head and down. For those for whom it's easy in lying down, you can use a bottle as a resistance, as a weight. You can fill the bottle as per how much you can lift, and you do them. Okay. Then you have your leg raises. Okay, so you can see Sheldon lifting up his legs straight. These are the straight leg raises. The same thing, Sheldon, you can come outwards.
One leg bent.
Okay, so they have to be done with both sides. This is the leg going sideways, outwards. Yeah. Then we have the knee slides where, yes, Sheldon, do it one at a time. Okay, so one leg at a time. So you bend one knee, get it to your chest, and down. You can do these with ankle weights if you all are fine with that. Okay, and the last one is very important, which is ankle pumps. Especially those people who, some of us may have varicose veins or swollen ankles and feet on calf. This exercise is very good. You raise your leg up a little bit, or you can place a pillow underneath and you keep pumping your calf muscle, your toes and your calf. Okay? Yeah. Then comes to a little bit, okay, now a little bit difficult, a little more tedious for some. This is called bridging. where you lift your whole back up. Okay, you bend your knees and then you raise your back
My
up.
stool.
Why
Why you take it there? That blue stool is there down.
Philomen had taken. I told her keep it back. Anyway, I'll bring it. It's there near the table.
Alvin, can you mute? Yeah, okay, thanks.
Okay. Then we have the hip twist. The hip twist is in this same position. You twist your hip. Shall we keep your arms out so that you're not lifting your shoulders up? Only your hip twist. This is going to help your back mobility. For those some of us who have back pains, this is one nice exercise. Okay. Then the next one is rolling on bed. For rolling on bed, sit in straight legs. Yes, and you just roll from one end of the bed to the other end of the bed. Okay, just keep rolling yourself. It's a very nice exercise and helps those with mobility issues in bed. Then you have the back extension. Can you please turn onto your front? Yeah. Place your hands to your sides. Hands to your sides. No. Back extensions are without hand support. Sheldon, first what you will do is raise your head up, raise your neck up, shoulders up. Okay, and down. Slowly. Once again. Raise your neck, head, neck, shoulder, and down. Helps your back a lot, okay? Especially some of us have got back, hunched back. This is one exercise which helps. Then another one which can be done is just getting your shoulders. No. In that same position, raise your shoulder, only your shoulders up. Get your shoulder blades together. Yeah, you can do that. And up. No. Elbows up. Elbows up. Yeah. Only the elbows come up and down. Okay. The next one is swimming on bed. Sheldon, can you? Yeah. So sorry about the space here, but it is basically swimming where you're going to extend your arms up, you're going to lift your shoulders up and rotate yourself. Yes. Thank you, Sheldon.
Not getting far.
Then there's another one. Half push-up. Okay. For those who are having back pain, low back pain, half push-up is use your hands and push yourself up and down, up and down. Do not try to push yourself very high at the start. Start slow and then come up. Okay. Right. Moving on to exercises now in sitting. So we start with our neck movements. So we have movements on the side. We can start with up down. Look up. Stretch yourself a little bit. You need to feel a stretch in the neck. Okay, your muscles, whichever you're doing, you should feel a stretch. Then move down. So when you're moving down, okay, you can't see it in that position, but we are not really pushing our head down. We are only tucking our chin in. From the sideways, we are only tucking our chin in. Okay? Yes. We have our shoulder shrugs.
Okay.
It's nice to see some of you are doing them as well. Then you have rounding of the shoulders.
Shoulder.
Good.
Chin.
Yeah. Okay. Then we have the arm raises. So for the arm raises, you can use again a water bottle, or you can use any weight, your ankle weight on ankle weights, or you can use TheraBands. Yeah. So you hold the bottle, you hold it up first, thumbs up, Bottle straight up, elbow straight up and down, up again and down. Okay, so I'm just showing you all the exercises and I'll give you all the guidelines of how to do it and how many times you all should repeat it. Okay, then now we go sideways, sideways down, hands down, yes, down, you go down, butterfly,
Okay.
okay, and up straight, sideways, sideways, yes.
Okay.
Only up and down. Alright, then we have this, hold it in this position, and go up and down. You can hold it that way. Here you can use a little heavier weight to do that. Alright, now coming to the famous biceps curl, to building good arms. So here you can use any kind of weight, okay, whichever you feel you're comfortable. You get TheraBands, you get these bands in different sizes, different strengths. Even the weights come in different. This is a 1 kg, but you get them in a half kg or even in even 250 grams. Then you have the resistance bands. So Sheldon has locked it under his foot. Okay, hold the tension here now, and then you bend it. You bend your muscle. You can use it that way as well. Okay. Same thing. Push up.
Ooh. Ooh.
So again, depends on your strength. According to your strength, you can select the resistance.
To make it easier with that.
You can make it easy and strong. Okay. The triceps as well will be backwards. You take it backwards, push it up. Yeah. Okay. Then you have the twists. So the twist, you are sitting straight without moving your buttocks. So your hip is going to be where it is. You're only going to take your shoulders to the opposite side. So your left will come to your right, but you see that your shoulder is in front of you. Okay? Yes. These are all mobility exercises, okay? They're all mobility exercises. Then you have the knee extensions, straightening of the knee and bending of the knee. It's best done when you put weights. Okay, so I put that 1 kg weight on Sheldon's ankle and he does his extensions. This is a very
Good on you, Sheldon. Good on you.
Okay. Why this is a very important exercise is because the quadriceps is a very bulky muscle, quadriceps and the hamstrings. So when you are doing weights and training your quadriceps muscle, this is that bulky muscle which you are even increasing more. It's the opposite of sarcopenia or atrophy, which is hypertrophy. We are increasing the bulk of this muscle.
I'm going to get good sleep tonight.
Okay. Then you can use this TheraBand, please hold it. Hold both ends. Now put your ankle here. So if you see what I have done is Sheldon is hold it closer to you, yeah. Give it a good resistance, bend your knees first, give it a good resistance and now push your knee forward. Are you feeling that resistance?
Yeah.
So this will help your buttock muscles and your quadriceps muscles. Okay? Right. Then we can do Then we can do the cycling, air cycling. So you're just sitting there and cycling. You can do it with both the weights on, so that you're increasing the weight to increase your muscle bulk again. or some flow mat. Then we have the chair sitting and this. Yeah, yeah. Okay. Now we see many of us, not only seniors but even youngsters. I'm seeing a lot of youngsters now having faulty feet. So their feet are, sometimes they are having collapsed arches, weakened feet, and when this happens to our seniors, chances of falls are more because their feet muscles itself are weak. They have collapsed, the arches have collapsed, and they are unable to now balance themselves. So this exercise will help you with that. So you need a towel or a floor mat or whatever. Okay. I will take the laptop there. Okay, place your feet, Sheldon, there. Okay, now both his feet are on the towel, and now Sheldon, I want you to start keep your heel fixed at one position and curl the towel. Curl the towel. Pull the towel inwards. Yes. Okay, so you got to keep making these curls. Straighten it again. Yes. Okay, so your heel is fixed on the ground. You can even do it without the towel. You can maybe wear some socks. You can wear socks and then do it. Another good way of doing this exercise is what I tell my patients: get sand in a tub, like a basin tub, and wet it. Keep it at your home. Sit and use that. Do the same thing with wet sand. Okay, you place your heel, then you start curling it in. Curl your toes in. So with that, you're going to strengthen the feet muscles. All right. Are we clear till now? Any doubts? Any difficulties? Can we have a thumbs up if it's clear? I will be also sending you all the full workout plan. Maybe I'll send you all videos. I'll record videos of myself or my assistant, and I'll send it across to you all. I'll share it with Sheldon as well. So you can always watch and do.
Can you
Okay?
please repeat the last part? What is said regarding the tub?
Yeah. Okay. So the tub is, we are going to use a basin, basically a 4-inch thickness depth basin, and you're going to put sand from the beach. You just get beach sand and fill it up. Not needed to fill it up, but you're going to put sand in that, and you're going to wet the sand. You're going to make the sand wet so it becomes harder. We don't want the sand to be loose because then it's going to just fly away and you're going to make your house more messy. Okay, if you have this is because it's rainy season now. Difficult to go to the beach. You can get the beach home. You can place your feet on that and then start doing the exercises. They're on wet sand, so you can make it straight again. Keep doing it. That's really good. You will one day you may find it your muscles getting a little sore. Then you can do it again the next day. No problem. Okay. Okay. Assuming
Is there
that
any, just one question, is there
Yes.
any age limit for using weights? I mean, if you're
there's no limit. I'll tell you why. When I joined the gym, because to get rid of my diabetes, I went to the gym and I saw this elderly man who's already had a double knee replacement, and he was doing these back exercises. So he was lifting the rack, and he was one of the few people in the gym. The instructor told me that he was one of the few gym goers, okay, who are using that full rack. He was lifting that full rack above his head to strengthen his back. I think that would be somewhere around 80-90 kgs of weight that he was lifting, which even the elite athletes don't use. Okay. Yeah, I see Sabrina doing weights, which is very nice. Yeah. Okay, so let's move on to the exercises in standing. Yeah. Okay. No, I'll just do it. We'll do it this way. Can you stand up?
What are you talking about?
Standing exercises.
Okay, so the exercise is in standing.
You already talked. Okay.
No, I hate myself actually.
Yeah. What did you hit yourself?
Okay, let me start with wall push-ups. Okay, so Sheldon, can you go to the wall? So what is Sheldon doing? He's just standing against the wall about a meter away, and he's going to dip his shoulder in and out. Yeah.
Okay.
Okay, these are wall push-ups. It's very good for your shoulders, for your back, for your chest muscles. Okay, I see Ursula doing it very well. Then we have the standing calf raises. Sheldon, you can take some support maybe of the wall, or you take my support here. Yeah. Okay, so if you see Sheldon here, he's taking support of the wall or the chair or a chair in front of him, and he's raising his calf. He's raising his ankles. He's going on his toes. Okay, it's a very good exercise for those who are having varicose veins, who are having swelling in their feet because of lack of mobility. Helps in circulation a lot. Okay? Then you have toe taps.
Hmm?
Okay, so toe taps would be you spread your legs, Sheldon. Okay, and now what you're going to do is you're going to bend, touch your toes. Okay, so it depends on the amount of mobility that you have. Don't really try to get full mobility if you cannot. Okay, don't aim for that. We are just trying to improve our mobility slowly. We don't really want to have accidents. So go slow in all that you're doing. If you cannot reach your toes, it's okay. You can reach your knees. Okay, so you have toe taps sideways and you have toe taps forward. As much as you can go. Don't push yourself too much, okay? You have to do it slowly. Okay, now you have trunk rotations or twists. So Sheldon, send that. So here, so what is Sheldon doing here is Sheldon, first you should not rotate your hip. That's what you were doing. Your hip is going to be fixed. You're only going to rotate your upper body. Yes. So what you can do here is keep your arms out and do that. Take that. Yes, across. Let your arms go across. Let your arms go more. Yes, 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 yes. So if you see here, he's not moving his hip. His hip is fixed while he's only moving his upper body. This is to improve the mobility in your back and spine. Okay, then we have squats, which is you can hold the chair in front of you and you go down like a squat. So you can hold something there. You don't really have it does so you don't have to go as low as that. Yes, very nice. You can hold the chair and go as low as you can. Now remember not to bend forward and do that, but instead you're only going to do this. The mini squats. You can take support of the wall as well. Okay. Now, stand this way. Okay. Now these are dumbbell rows. Bend, take support here, and here is going to lift it up. Hold your weight and lift it up. Remember to hold the back straight. Don't arch the back. Okay, so in this, then you can, all the exercises are the same then. Those which you did in sitting, you can do them in standing as well. Okay. There's another stretch, another strengthening one for tibialis anterior. Shall I come please? Quickly, let's do this quickly. Okay, so here he's going to lean on the wall. Just keep leaning apart. Okay, in front of. Okay, so Sheldon is standing here with about 1 foot away, and now Sheldon, you're going to raise your toes. Yes. This is again going to help you all with balance. Okay, so he's on the heel and he's only raising the toes up, toes and feet up. Okay, yeah. Thank you. And for those who are having balance issues, standing on toes, you can try doing it without holding, without using the chair. Just try balancing yourself. You can maybe hold one side. Yes, very nice. Okay. And then maybe you can do a squat from a lower chair coming up. If that is still easier, then you do a single leg squat. And the best for balance is tandem walking. Tandem walking is when you walk with your feet. So the foot in front of the heel of the foot in front of him will touch that, and you walk that way. You try to go in a straight line. Okay, so yeah. Okay, so yes, we are done with most of our exercises. Again, it is very important to do have a cool down, just like how you had a 5-10 minutes, 5 minutes of warm up. You need to do a cool down. A cool down will be just stretches. So if you have worked your upper body, you'll do some stretches there. You'll stretch your neck. You will just move your legs, stretch your feet, do some breathing exercises, start breathing deeper and slower. You're going to try lowering your heart rate very slowly. Okay, this is especially to be done when you have done strength training. After the strength training, if you have worked your legs out, you're going to see that you stretch those muscles up a bit. Okay. Yes, we are done. I would appreciate if you all have any doubts or queries and want to ask. This is the time when you can ask.
Anybody's got
Kindly
any?
send us the videos, please.
Yes, that for sure. I will do that. I promise to do that.
And how
Which
much
TheraBand
time?
would you recommend? TheraBands, there are many available. I prefer buying them on Amazon because one thing is they are cheaper. Secondly, they come to my house. I don't really have to go and select the ones in the stores. It becomes difficult. So yeah, color. It depends. Many of
Light, so light for light workout.
yeah, so if you go on Amazon, like this is on Amazon Basics, this one says light. It always tells you the strength. There is light, medium, extra light, extra heavy. Different brands again have got different strengths, different color codes for them. So it depends on the brand that you're buying.
But start off with the light one. Otherwise,
Yes, always start with light. Always start off with light.
Yeah. Any other queries? Any other doubts? Any questions?
How long should each exercise be done?
Yes.
Stretch. What
Pardon
do we
me?
call it? What do we call it?
This is a TheraBand.
TheraBand.
TheraBand or a resistant band. Resistance band. Okay. Now, all the exercises, it's best to have a uniform count. I prefer count of 10, 3 sets. So a set of 10, 3 times. Okay, so if you're doing a biceps curl, you will do it 10 times, take a break, do the other hand 10 times, repeat it again. Okay, then move, or you can do all of the exercises as one set and repeat that 2 more times. So that way you're giving all the muscles rest, and then you come back again.
I got a question. If you have so many exercises, do we pick up few exercises every day and then do different exercises every day like that,
So it's a nice question. The thing is, you have to ask your body. Your body will tell you. Maybe you can do it the first. You can do all of them the first day, and then your body will tell you. If you feel you're sore doing all of it, then do some of it. Don't do everything. Do some exercises like the upper body. Do one day. Do only. If you're doing, this is mainly for those who are doing strength training. So if you feel you're using heavy weights, or the weight is easier for you, or you want to go higher, then do say upper body, which means biceps, triceps, chest, shoulders. Work them out first. Then give it a break while you're doing next 1 or 2 days. You're giving it a break and you're doing cardio in between, and then do the legs the next time. That way you are not going to feel so. You're going to like it because less pain. You will like the exercises. It will become more easier to do. Otherwise, you're going to get demotivated at the first time itself. So yeah.
any other doubts?
Excuse me.
Yeah.
Excuse me. Do you lose weight? Do you lose weight in diabetes?
Very much, very much. Yes, you do lose weight in diabetics. I would consider me as well in that, and I lost 3 to 4 kgs in 1.5 2 months of going to the gym 3 times a week. 3 to 4 times a week I would go to the gym. Once a week I would play football. I lost about 3 kgs of weight, and I stopped and I gained it back. Yeah.
Thank you.
Tell me, instead of walking for
Yeah.
150 minutes a week, can we just do dancing 150 minutes a week? Is that the same?
Perfect. Perfect. I mean, even I would love to dance. I like dancing. It's just that my wife is too busy and I need company. So yeah,
Dance alone.
Dance alone.
I'll have to
Yeah,
repost
I
it.
dance alone.
Dance. That's what I do.
Ah, very nice, very nice, very nice, very nice. No, any form of activity is very good. It's very helpful. It is very healthy. Like I said, the 80-year-old man who was there at the gym was lifting that full 90 kgs rack of weights, which was incredible. So I mean, if he can do it at that age, I think we can definitely aim to get more fitter, to get more stronger. For me, fitness is being able to run away from a dog. If a dog is chasing you, you should have that energy and strength to at least run away from there. That is what I call fitness. To save yourself.
We have to hope the dog is really fat, right? Very slow dog, very lethargic dog, unfed for many days, or unfed for many days, and doesn't have the energy to chase us too much.
Sounds better.
For someone who's had a quadruple bypass, how long can he exercise?
Now, those who have
Over
had
80, he's 84.
So for those individuals who have undergone surgeries, especially with related to the heart, it is best to get your guidance from your cardiologist. Get yourself tested get the stress test done again to see how there are monitors for that. You can get those bands. You can get a BPM apparatus, the digital one, which shows you your heart rate and stuff like that. So your doctor will definitely tell you your target heart rate. No exercise is bad, but it is how much you do it. So those who have heart conditions should not really overdo themselves, because the heart rate should not increase so much. There's a target heart rate for those patients. So it's best you speak to your cardiologist and ask them these questions of what is my target heart rate. So based on that, now you can get your heart rate on your smartwatch. You can wear the pressure cuff which you get. It tells you the heart rate. Maybe even a pulse oximeter will tell you your heart rate as well.
Can I butt in? Sorry.
Thank you.
So, with regard to that question, I'll give you my experience. In the month of March, I was taking my dad to the cardiologist and the neurologist quite a lot. And after he was diagnosed with everything, what the cardiologist and neurologist did was they said you have to go to a physiotherapist, and he gave a specific paper to this physiotherapist to say that you have to do this, you have to do this kind of exercise, this kind of exercise, this kind of exercise for this person, So it's always you have to go to the cardiologist and ask them what the heart, and they will prescribe what kind of exercise and what heart rate and all that has to be maintained. And then you have to come to a physiotherapist, and the physiotherapist will give you exercises based on that.
Thank you. Thank you so much.
Anything else?
Any other questions?
Thank you so much. You were so clear. And all my doubts went while you were explaining. So I just had everything, but not doing it correctly. So thank you so very much for showing us and using Sheldon as our thing. Sheldon, so this video will be on YouTube?
This session's video also will be on YouTube.
Very
and
good.
Gladwin will also send us videos of the exercises to be done, as in a series,
Yeah.
with one rep each, so that we can look at that and just follow it.
Yes, because this really corrected so many things that I was doing wrong.
That would be very good. So we can follow that and we can do it nicely.
Yeah.
Okay?
Yeah. And Gladwin will put some music in the background so you all can enjoy it as well.
Yes, yes.
Sing along. Okay.
From where are you in Bombay?
Gladwin,
Karansalam.
Karansalam, Goa.
Okay, in Goa. I thought in Bombay you said. He's come all the way to Goa.
People come from Bombay to Goa. I know friends
Okay,
from
that's
Mahim
it.
who have.
Alright, okay.
I met at the clinic. I didn't even know that they were coming all the way from Bombay just to his clinic, just to get their back sorted out.
Yeah. Okay, great. Thank you.
Some of you all must have, if you all were there for the physical session in Panjim, one of my friends, his name is also Sheldon. He's from Mahim. He came over for the physical session. You all must have met him. He actually came to Goa just to go to Gladwin. So yeah. Anyway, we are so happy to have Gladwin on the Memory Cafe team. To be honest with you, he has. We are trying to increase the memory with registering. We are trying to get a good panel of doctors to collaborate with regard to Memory Cafe, and Gladwin is one of them. And he has, out of his generous heart, has said that any of the seniors would like to visit the clinic, right? Yeah, visit the clinic or a thing. You're most welcome. Okay, he would give a discount for the Memory Cafe seniors. He also does home visits. He also does home visit for the homebound. So that's also an option that by Gladwin.
Is it possible? Hello, is it possible to have a video like this so that we can all take part in it on Zoom? Possible?
Yes. So he'll be making a proper video of all the exercises, and then we can follow that. Now he's going to make a video of 20 minutes, right?
20 to 30 minutes.
20 to 30 minutes.
Thank you. That's what would be very helpful.
Everything.
Yeah, very good.
So you just play that and you just follow it as he goes.
Yeah.
Excellent.
But it will be on Zoom? It will be on Zoom?
No, it is going to be on YouTube. Then anytime, every day you want to, you just play it and then you can continue.
So I will be making videos
on YouTube?
Yes.
Yes, it will be on YouTube. Yes, it will be on
lovely,
YouTube.
lovely.
So what you can do is, if you have any suggestions, just message Sheldon and I will make appropriate videos for that. So if you say I have back pain and I want some videos that help me for my back pain, with a little bit of description, you can maybe get in touch with him, get in touch with me, and I will make a specific video for those who have back pain. Maybe if you want just fitness, and if your fitness level is good, you're able to use weights, you're able to do that. So I will train you then in that way. For for those who want a very milder form of exercise, I can make a video in that way. So I'm open to suggestions. I'm open to uh, customizing my videos.
Can we do one video of a 20-minute what the seniors can do like thrice a week?
Right.
Which is a full body sort
Yeah.
of
Hands and legs.
yeah, for the full body. While then we could have smaller videos for the back, for the arm, upper body, and for the lower body. You know, we can do something like that. Right? Yeah. Okay. There was one question which came in. Sorry.
Yeah, it's from Leah.
What's the best?
For plantar.
For plantar fasciitis, yes. You remember the video which I showed where Sheldon was using his toes and the sand and stuff?
Yeah.
Yeah, that is one very good exercise for that. The other thing is you can just freeze a small cold drink bottle, just put some water in that and freeze it and use that bottle, keep it under your feet and then roll it at least 2-3 times a day. Just place it over there so that coolness will also help as an anti-inflammatory while you're also getting it to stretch while you're rolling it under your feet. That is one thing. What I personally do for plantar fasciitis, I stretch the calf muscles, I release the tight muscles. I work very manually, so I use my hands to release the calf. Sometimes the calf muscles are tight, the fascia is tight, so we start releasing it and making it easier to make it softer.
So Gladwin, that would be a request if you could put in an exercise for that, a short, yeah.
I'll do that.
So something that could be followed. So it would be like a sequence, starting from top and then coming down.
Yes, I would appreciate that. I would love to do it. I always wanted to do such stuff, and since Sheldon also got in touch with me, I will be very happy to collaborate.
Sheldon, please take your mum to him for her sciatica.
For sciatica, yes.
Varicose veins.
Varicose vein. Anything for varicose veins?
So for varicose veins, there are some exercises known as Berger's exercise. You lie down on the bed, at the edge of the bed, and you drop your leg down.
Okay.
I know we are running short of time, but yeah, let me just show you since it comes. Okay. Go back. Okay, come to the page. Okay, yeah. So what you're going to do here is you're going to drop that leg, one leg down. Keep it down for about 2-3 minutes.
Acha.
Once it's down,
okay,
you're going to raise it up and no, not so high, around 40-45 degrees.
Okay.
And for 1 to 2 minutes. Maybe you can use a pillow to support you up.
Okay.
And then pump your calf. Okay, this is very important. And repeat the whole cycle again. So it goes down for 3 minutes.
Don't put it on the ground.
No. Doesn't touch the floor.
Don't touch the floor.
Let it be down.
No.
It can touch the floor?
It can. If your bed is low,
you can. Yeah.
Okay, so mainly
but for how long? How long?
This is to be done, repeated about 4 to 5 times. Okay, so your main goal over here is to increase circulation, to allow the blood to move down. So
but when you put your leg down, how long? 1 minute, 2 minutes?
2 to 3 minutes. 2 to 3 minutes.
Fine.
So what you're doing is you're getting fresh blood down. You're raising your leg up and you're doing your pump, calf pump, and you're pushing that blood out. So you're circulating the blood.
All right.
It's advised not to stand for more than 20 minutes. Even if you're seated, you should sit with your legs extended. Keep it on a stool or maybe a little higher and keep pumping your calf again, because that's the only way you can pump the blood up.
Gladwin, this exercise, when there is pain, can we do it, or you should wait for the pain to subside?
Which pain?
This sciatic pain, sometimes the pain is very excruciating. So at that time,
sciatic pain, you see, there are multiple reasons that you can get sciatic pain. One is if the sciatic nerve is caught up in the spine, if the disc is prolapsed, sometimes the muscle in your buttock, the piriformis, if that is inflamed, then the passing through that muscle gets caught up, which is another sciatica. So, sciatica, if you say, is just a symptom, but the main cause could be pain. So we need to figure out what is the cause and accordingly treat it.
Okay.
But it is very much treatable with exercises. We just need to know what is the cause of that.
Cause of it. Okay. Okay. Thank you.
Thank you so much.
Thank you very much. God bless you.
Thank you very much.
I do some exercise for the sciatica, lying on the bed, and then putting my right leg right across, holding it with my left hand, and counting breathing till about 5 seconds, and then bringing it back.
Okay.
Doing the same thing with my left leg, putting it right across and holding it with my hand.
Yeah.
So that
there are a lot of exercises that can do. Again, I would not, when it's a sciatica, your nerve is actually caught up. Okay, it's entrapped. So we need to figure out what is the cause.
Yes.
Until that is the thing, I would not say do an exercise, because I always like to be on the safe side. Now imaging has become very easy. It's easily available. I prefer sometimes, if I'm not very sure if it's a thing come from far, then I like to see the X-ray or the MRI. Then I can tell you what's to be done, because a lot of times, sometimes you can get. I can do the opposite. Then you may tell me a symptom, but if I'm not, I can't assume that it is coming from the back, or if it is where the sciatic nerve is caught.
Ursula, but I'm very impressed.
By a doctor. A doctor told me this exercise, and that's why I've been doing it.
No, it's fine. It's fine to do. I'm not saying no. But again, if the cause of the pain is your disc, then maybe that exercise may not help. It could worsen. Things like that.
But Ursula, I'm very impressed with your exercise. A little bit more and you'll become Baba Ramdev.
Yes, and I would like to show you this too, which I roll my legs on.
You can use it.
That's good. That's good. Okay. Thank you everyone
Thank you
for
very
this
much.
session. Thank you for joining in.